We have one of those key votes joining us now from the Russell Senate Office Building. Roger Wicker, Republican from Mississippi. Appreciate your time this morning. We've been having this discussion all morning about the health care legislation. Can you just give us a latest status update? We're hearing about a rewrite of the Senate bill, possibly trying to get it to the Congressional Budget Office by Friday. Where is this as far as you know?
I have to say, first of all, I hate to break into this great discussion. And Governor McCoy, thank you for making a very strong case for doing something that's going to help millions and millions of Americans. So I'm eager to make my point and get back to listening to this great discussion. I think there's been some movement. Clearly, there's some people in the Ohio Valley that feel real strongly that we need around $45 billion more in Medicaid to fight the opioid epidemic. It's very serious, and I think it's something that we can do around the edges there that's not going to affect the outcome in future decades, and maybe gets us to 50 people with a yes. And then I was encouraged to hear that there might be some movement toward allowing people to buy their own insurance out of health savings accounts, and that should make those of us on the right happier about the bill. So I think there's movement in the right direction. There was a willingness yesterday in our caucus among everybody to work hard to get to yes, and there were some people who've been intransigent on issues in the past that seem really genuinely striving to reach a consensus. So I feel good about it. I'm optimistic. I don't know if we'll get there today or tomorrow, but I think we are moving toward an opportunity for a real, honest-to-goodness Medicaid reform that works better for people and makes this program sustainable for future decades.
Also yesterday, President Trump suggested a big surprise was in store for the Senate bill. Can you give us any insight as to what that might be? Was he referring to what you were just talking about, possibly?
Well, perhaps he was. Further than that, I don't know. I guess the surprise would be harmonic convergence and a bill that people like Susan Collins and Ted Cruz could have a big hug about.
What sort of role do you see the president playing in this process as this debate continues?
A very important role, and part of that, of course, is Mike Pence, who served with a lot of us. I was a colleague of his in the House of Representatives before we went on to different offices. Reince Priebus, the chief of staff, is very helpful. Seema Verma, the chief health person in the administration, has been very, very active. But I think the president getting us together a couple of days ago in the White House, sitting around the room and getting rolling sleeves up and getting down into the weeds on the issues, I think was helpful, and I think he continues to be helpful.
The president tweeted yesterday about his level of engagement on this topic, about his knowledge about health care. Do you consider the president a policy wonk on health care? When you say get down into the weeds, is he doing that in specific issues? Where do you see his expertise?
Well, I don't consider Donald Trump or Senator Roger Wicker to be a policy wonk, but I think we understand the basics of this issue, and I was quite impressed with the president's command of the issues, particularly the stabilization funds that Uncle Sugar's having to write huge checks for continuously to prop up the system that is failing. I mean, I think the president understands what we're up against. We are up against a system that is failing. The markets are collapsing, and we can't keep writing these huge multi-billion-dollar checks to stabilize the market forever when we can do something a lot better and make the system last for a long time, and also give people like people in my state an opportunity to have a refundable tax credit to buy real insurance, to buy better type of coverage than Medicaid. If you've got a choice of getting on Blue Cross Blue Shield or Anthem or Geico or whatever, rather than staying on Medicaid, you want to get on real insurance rather than this government-funded type.
And Senator Wicker, I know you have to go in about a minute or so, but I did want to ask you, we asked our viewers at the beginning of our program today, should Republicans negotiate with Democrats when it comes to the health care issue? I want to get your thoughts on that since we spent an hour talking to our viewers about it.
I do join with the president in wondering if they're serious about this. Let me just say, from the outset, former President Obama said, don't put your fingerprints on this bill. Let the Republicans own it. Senator Schumer changed his tune yesterday, but he all along, since January, he's been saying this is for the Republicans to do, and we're not going to have any part of it. I think maybe yesterday, Senator Schumer realized that we Republicans might be getting close to getting to 50, and now suddenly he wants all 100 senators to have a meeting with the President of the White House. I think we're close to getting something very helpful and very meaningful done in terms of entitlement reform, and I think that's the path to a good result right now.
Senator Wicker, appreciate your time on a busy day. Thanks so much.
Thank you.